Hello everyone, I'm Skip from YINGCHI, and today's topic is about how does TMS help us in post-COVID-19 world. And these are our social media. You can also follow our YouTube channel to see more training videos. And as for the topic today, I will mainly discuss this topic in 5 aspects with you. And first, we will share some latest research findings concerning the after effects of COVID-19. And this is an research has published in October this year that they have found a relatively high frequency of cognitive impairment several months after patients contracted COVID-19, and certain populations, including the older adults, may be particularly susceptible to cognitive impairment after critical illnesses. But which is interesting is that in the relatively young cohort in the present study, a substantial proportion exhibited cognitive dysfunction several months after recovering from COVID-19, which means that even the young people who are suffered from COVID-19 may cause some degree of cognitive dysfunction. And as we can see, the aspects that their cognitive function is mainly affected on their attention, working memory, processing speed, and executive functioning, and so on. And here is another research published on Nature Neuroscience on November 2021. They have drawn a conclusion that the coronavirus disease 2019, which is the COVID-19, can damage cerebral small vessels and cause neurological symptoms. And this pandemics causes disruption, anxiety, stress, and stigma, xenophobia, which means that some of the people in some country may relate COVID-19 with politics, and some of them will name the virus with some country and some city. And the behavior of an individual as a unit of society or a community has marked effects on the dynamics of a pandemic that involves the level of severity, degree of flow, and its after effects. Except from the pandemic itself, the pandemic also has impact on because of its restrictive measures. And because of the rapid human-to-human transmission of the COVID-19, some of the government may have the enforcement of regional lockdowns to stem the further spread of the disease, such as social distancing. And in some articles, they also concluded that this suddenly change of their environment can drastically affect the management of other diseases, including mental health, which usually exacerbates during the pandemic, and individuals' mental health status can be drastically affected. So the COVID-19 can have some impact and lead us to some challenges on our mental health. And this is in research published on the Lancet Psychiatry in July 2020 that they have concluded that the clinicians should be aware of the possibility of depression, anxiety, fatigue, post-traumatic stress disorder, and some other neuropsychiatric syndromes in the longer term. So the pandemic, it is not only considered about the respiratory symptoms, but also the mental symptoms. And here is another research finding shows that a significant increase in the risk of COVID-19 severity and mortality among patients with mental disorders. And some study shows that, as you can see in this figure, that the COVID-19 will cause certain degree of depression on some of the patients. And in this study, more than half of the patients have moderate or greater depressive symptoms. And concerning the US, the incidence of depression during the COVID-19 pandemic is as large as 3 times higher than before the pandemic in the US, whether it is a mild symptom or a severe symptom. And as for the addiction and craving, the COVID-19 pandemic and mitigation efforts have been associated with elevated distress in general, provoking a surge of addictive behaviors. And these behaviors can be new and relapse, including misuse or abuse of alcohol, tobacco, and some drugs. Particularly those have already had some substance use disorders, present immune system, respiratory, and pulmonary changes that may increase susceptibility to COVID-19 infection. And consider to the sleep disorders, whether it is the general population, the health care workers, as well as patients in post-acute recovery, has reported high rates of sleep disorders related mainly to changes in stress levels and anxiety. For the patient, especially the pandemic has an enormous stressor for individuals with OCD, especially for those with contamination symptoms. They may keep washing their hands, and so the spreading and effective delivering evidence-based treatments for OCD is an urgent public health priority. And we all know that the health care workers are on the first line to cope with the pandemic. And we have found a high risk of them developing psychological distress, such as PTSD and PTSS, which is the post-traumatic stress symptom. And this review of the prevalence of PTSD after pandemics has showed that, as we can see, for the SARS, even after 3 years suffered from the SARS, and 10% of the health care worker may still have the symptom of PTSD. And the patients during COVID-19, as for the general public, has as large as 60% of prevalence of PTSD. And concerning about the neurological disorders, as for the PD and AD, and the COVID-19 infection might trigger PT neurodegeneration by accelerating aging in brain tissues. As for the AD, and the AD neurodegeneration diseases unmasked through silent viral infection in their brain. As for the multiple sclerosis, no evidence supporting MS related to neurodegeneration and males, but they do have some certain vulnerability to develop neuropsychiatric symptoms during COVID-19 pandemic. As for the COVID-19 infection and the relationship between COVID-19 infection and neurodegeneration in Alzheimer's disease and Parkinson's disease. As for the Parkinson's disease, it is mainly caused neurodegeneration, but as for the Alzheimer's disease, it will cause certain neuroinflammation. And some study has showed that the presence of antibodies against coronavirus in the cerebrospinal fluid of patients with PD has been found more than 2 decades ago. And the ability of coronavirus to enter the brain through the nasal cavity, causing anosmia and hyposmia, which is a kind of loss of the sense of smell, and the fact that hyposmia is a common premotor feature of PD And COVID-19 also complicates the clinical course of PD, resulting in a worsening of motor and non-motor symptoms, especially for urinary issues and fatigue, increased anxiety with severe complications on the quality of life and their mental health. And the immune response and excessive inflammation in COVID-19 may also accelerate the progression of brain inflammatory neurodegeneration, and those elderly individuals are more susceptible to severe outcomes after SARS-CoV-2 infection. And the worsening of clinical spectrum, especially neuropsychiatric symptoms such as depression during COVID-19 pandemic, will happen in patients suffered from AD. So here comes to a question that we have facing some challenges for patients with AD and other dementias, and we need to tackle these challenges in care of those patients, not only for now, but in the future. And some symptoms of ischemic stroke has been reported in some of the articles, but data are lacking to determine the specific features related to SARS-CoV-2 infection. And the possible reasons or the etiology of stroke in COVID-19 patients is multiple. It may be related to coagulopathy, inflammation, platelet activation, and changes to the vascular endothelium. And 8 to 12% of patients may present headache in more than 40,000 COVID-19 patients, and the chronic tension type headache, which may be induced by anxiety, depression, tension. And this kind of headache is easily overlooked because it's chronic symptoms, and it is hard for patients to seek professional help, and some of the patients may take medicines by themselves. However, the long-term use of drugs can also cause some side effects to patients, such as drug dependence. So the management of the after effects of COVID-19 is really important. And here we recommended the application of TMS, and we will also provide you with some of the protocols of TMS. So here is the guidelines for TMS clinical services and research through the pandemic in May 2020. And they have concluded that there is an evident and in cases urgent need to maintain non-invasive brain stimulation operations through the COVID-19 pandemic. And the benefit is not only for now, but also for the future use. So the applications of non-invasive brain stimulation, such as TMS, for the management of disorders related to COVID-19 may be through these 4 pathways. First, it has a direct infection mitigation through the stimulation regions involved in the regulation of systematic anti-inflammatory responses. And also it can improve the COVID-19 symptoms of musculoskeletal pain and systemic fatigue, augmenting cognitive physical rehabilitation following critical illnesses, and it can also treat outbreak-related mental distress, including neurological and psychiatric disorders exacerbated by surrounding psychosocial stressors related to COVID-19. And the TMS also has an European evidence-based guidelines for its therapeutic use, and they have highlighted that rTMS can produce significant clinical improvement in various neurological and psychiatric disorders, and they have a higher evidence of efficacy in applied rTMS in depression, pain, and post-acute motor stroke. And TMS also has its international safety guidelines, and these guidelines, which is published by IFCN, has updated in 2020, and this new version of guidelines taking into account the safety of new technologies and equipment, and providing operational guidelines for the future use of TMS. And FDA also approved TMS applications as early as 2008, has mainly used for the major depressive disorder, migraine, OCD, treatment-resistant depression, smoking addiction, and some decreasing anxiety symptoms in depressed patients. This is the FDA-approved TMS protocols for the treatment of depression. Whether it is use a 10 Hz rTMS or to use an ITBS can achieve a good result. And especially for the ITBS, the total duration, which is the treatment time, can be shortened to only 3 minutes. And this is an application case for the TMS used in the treatment of depression. And as you can see in this graph, ITBS was non-inferior to 10 Hz rTMS for the treatment of depression. And what's more, by use of ITBS, the number of patients treated per day with current rTMS devices can be increased several times without compromising clinical effectiveness. So, which is a fast but also effective protocol for depression patients. And FDA also approved TMS in the treatment of OCD, and they have published an article about it, and they have recruited 100 patients, and 38% of patients responded to the TMS protocol, and they have used a double coil over the dorsal medial prefrontal cortex with 20 Hz, which is a high frequency rTMS on the patients. And this is another literature case concerning the use of rTMS in the treatment of OCD. They have used 20 Hz rTMS over the MPFC and ACC with 2,000 pulses. And they have found a reduction in their YBOCS score in the active treatment group. And the result is significantly greater than sham TMS group. And at the 1 month follow-up, the response rates were 45% in the active treatment group compared to the sham treatment group. It acquired a significant result even after 1 month, even after the treatment is ended, and the results can last for at least 1 month. And they have concluded that TMS is a potential intervention for patients who do not respond adequately to pharmacological and psychological interventions. And TMS can also use in the treatment of addiction and craving. And in this study, they have used 10 daily sessions over 2 weeks with a high frequency rTMS, 3,000 passes each session to the left DLPFC. And they have found that even a single session of rTMS over the left LDLPFC reduces cue-induced craving. And the daily MRI-guided rTMS to the left DLPFC for 10 days reduces cigarette consumption and cued craving for up to 1 month, and also increases the likelihood of smoking cessation, as you can see the results in this figure. And TMS can also use in the treatment of sleep disorder. A low frequency rTMS or DLPFC or PCC was effective to improve sleep quality in subjects with primary insomnia. And a high frequency and low frequency rTMS over M1 or the SMA has beneficial effects in patients with restless leg syndrome, which is a kind of motor symptom. And high frequency rTMS or DLPFC might improve the excessive daytime sleepiness symptoms in patients. And RTMS can also help patients with sleep bruxism, which is grinding their teeth during their sleep. So TMS is quite useful for patients with sleep disorders. For the treatment of PTSD, this is a study for 10 days, 10 daily treatments of 10 Hz RTMS at 80% of motor threshold over the left DLPFC. I'm sorry, here we has write it wrong. And the PTSD core symptoms has markedly improved with this treatment, as you can see in this figure. And high frequency RTMS over the right DLPFC alleviated anxiety symptoms in PTSD patients. This is the results from baseline to follow-up 2 weeks after the end of treatment. Still, compared to the 1 Hz RTMS and the sham TMS, the 10 Hz RTMS still has a significant results. And RTMS can also use to treat the Parkinson's disease, and especially for the levodopa-induced dyskinesias. And when stimulate the cerebellum with CTBS, which is similar to low-frequency RTMS, can achieve good results. And the RTMS itself can also affect the production of the dopamine in the substantia nigra striatum with a high frequency RTMS over the M1 area or DLPFC, and which can increase the release of dopamine. And this is a protocol from Professor Zheng Zhong from West China Hospital. And let's see the patients before the TMS treatment and after TMS treatment. You may find that the old lady in this video has achieved good results, and this old lady has suffered from Parkinson's disease for many years, and she also has a bad temper and the depressive symptoms. But after TMS, she seems to be calm, and his motor symptoms, his essential tremor, has been relieved a lot. And RTMS can also use on depression of Parkinson's disease and to stimulate their left prefrontal cortex. And after the treatment, depression rating scales 30 days after treatment ended has a significant results compared to the sham TMS group. And the accuracy of Stroop test has a significant improvement than the sham TMS group. So they draw a conclusion that the beneficial effect of high frequency left DLPFC rTMS on depression in Parkinson's disease, lasting at least 30 days after treatment. So the non-invasive brain stimulation with or without cognitive training has a potential to improve cognitive in AD and related dementias, as you can see in this review. The largest improvement was seen in mild AD compared to the moderate AD, and a large scale of trials and a lack of consistency in treatment parameters precludes definitive conclusions. So we still need to do more treatments or to do more research on the AD patients with TMS. In this study, they have conducted low-frequency rTMS on the left posterior parietal cortex to treat patients with ischemic stroke, especially for the right hemisphere damage. And as you can see in this figure, it has shows a positive effects of treatment in 7 out of 10 patients. So they have drawn a conclusion that low-frequency repetitive TMS, which is the rTMS or left PPC, normalizes this overexcitability and also improve visual neglect on an experimental measure. And rTMS of M1 area can also improve spasticity in multiple sclerosis. And after 2-week rTMS, we can see a significant improvement of lower limb spasticity. And this is the last stimulation session. And the clinical improvement was long-lasting, and it lasts for at least 7 days after the end of treatment. And so thus they have drawn a conclusion that rTMS may improve spasticity in multiple sclerosis. And as you can see, this result is compared to the sham rTMS group. This is the recommended protocols from evidence-based guidelines we have mentioned before concerning the mental diseases. This is also the recommendation from the evidence-based guidelines concerning the neurological disease. This is concerning the neurological disorders, and this is for the mental disorders. And these are some of the experimental protocols cited from Shenzhen People's Hospital. And these are the experiential protocols added by Dr. Zheng Zhong. So China has responded vigorously to the epidemic, and the country also pays more attention to the mental health of the people, and at the same time promotes the applications of TMS in China. And TMS has achieved good market growth in China. And let's see some of the applications of YINGCHI TMS in China. So this is a hospital in Tianjin, China, and they have introduced 20 sets of YINGCHI TMS. This is the Shandong Mental Health Care Hospital, and they have introduced 10 YINGCHI TMS. This is also a hospital from Shenzhen, and they have introduced 14 sets of YINGCHI TMS. So this is Shenzhen People's Hospital, and we have cited their experiential protocols, and they have also introduced 6 sets of YINGCHI TMS. And this is West China Hospital, Sichuan University, and we have also cited their protocols before, and they have also introduced 5 sets of YINGCHI TMS. So as for the YINGCHI TMS, we have a powerful cooling system to let you have no worry for the overheating problems, and the design is is based on the ergonomics, and we have the unique user-friendly quick steam software, and our stimulator has embedded software, and you can predefine 5 treatment protocol and through one button, and to choose each one of them very easily. And we can also provide quick after-sales service and efficient training. These are some good feedbacks about YINGCHI double pin coil from our customers, and their patients are also willing to try the double pin coil. So that's all for my presentation.